Welcome to The Political Bridge, the podcast dedicated to fostering informed discussion across the political spectrum. I'm your host, Ada. Today, we're diving into a critical and often contentious issue: the federal government's efforts to combat fraud in healthcare. With billions of taxpayer dollars at stake, the push for stricter oversight is understandable. However, concerns about potential bureaucratic overreach, its impact on healthcare providers, and patient access are equally valid. We'll explore the delicate balance between protecting public funds and ensuring an efficient, accessible healthcare system. Joining me to navigate this complex terrain are Nico, our conservative voice, and Jordan, our progressive voice. We'll examine the arguments for and against the current approaches, looking at their efficacy and broader implications. Nico, let's start with you.
Thank you, Ada. The federal government's role in combating healthcare fraud is not just justified, it's essential for fiscal responsibility. Estimates suggest healthcare fraud costs taxpayers upwards of $100 billion annually, a staggering sum that diverts resources from legitimate patient care and inflates healthcare costs for everyone. Programs like Medicare and Medicaid, funded by taxpayers, are particularly vulnerable. The False Claims Act, for instance, has been instrumental, recovering over $5.6 billion in fraud settlements and judgments in 2023 alone. This isn't bureaucratic overreach, it's responsible stewardship of public funds. Without robust federal enforcement, unscrupulous actors would run rampant, eroding public trust and bankrupting vital programs. Strong federal oversight ensures accountability, deters criminal activity, and ultimately protects the solvency of our healthcare system for future generations. We must prioritize the integrity of these programs over the complaints of those who might find increased scrutiny inconvenient.
While I agree that combating fraud is important, Nico, we must critically examine the methods and their unintended consequences. The current federal crackdown, while well-intentioned, often creates an environment of fear and excessive regulation that disproportionately impacts legitimate providers. Small practices, rural hospitals, and community clinics, already operating on thin margins, struggle to navigate complex and ever-changing compliance requirements. This leads to defensive medicine, where providers order unnecessary tests to avoid potential accusations, driving up costs, or they simply avoid treating high-risk patients. The administrative burden can be so immense that it forces providers to reduce services or even close, exacerbating healthcare access issues, especially in underserved areas. We need targeted, data-driven approaches that distinguish between malicious fraud and honest mistakes, rather than a broad-brush strategy that stifles innovation and burdens our healthcare heroes.
Both of you raise crucial points regarding the scale of fraud and the potential for unintended consequences. Nico, you highlighted the significant financial recovery through acts like the False Claims Act. Jordan, you brought up the burden on providers. My first question to both of you is this: how do we strike a balance between aggressive enforcement to reclaim taxpayer money and ensuring that these efforts don't inadvertently create barriers to care or disproportionately penalize providers for minor errors, especially given the complexity of medical billing and coding? What specific mechanisms or reforms could better delineate between fraud and error?
Ada, the balance is struck by maintaining clear, consistent regulations and focusing enforcement on verifiable intent to defraud. The Department of Justice and HHS-OIG already employ sophisticated data analytics to identify patterns indicative of fraud, not just isolated errors. For instance, the Medicare Fraud Strike Force uses advanced algorithms to pinpoint providers with unusually high billing for certain procedures or services. Furthermore, the False Claims Act includes provisions for whistleblowers, often insiders, who provide direct evidence of fraud, which is far from targeting minor errors. We need to strengthen these intelligence-led operations. Rather than softening enforcement, we should invest in better technology and training for investigators to more accurately distinguish between genuine criminal intent and administrative mistakes, ensuring that resources are directed where they are most needed to recover substantial sums and deter large-scale schemes.
Nico, while data analytics are valuable, their application can be overly broad and lead to false positives, creating a guilty until proven innocent dynamic for providers. Many alleged fraud cases are often due to complex coding errors or lack of clarity in evolving regulations, not malicious intent. For example, a 23 study by the American Medical Association highlighted how frequent changes to coding guidelines make compliance a moving target. To strike a better balance, we need to shift from a punitive first approach to one that prioritizes education and support for compliance. Implementing safe harbors for good faith errors, offering clearer guidance, and providing accessible compliance assistance to small practices would be transformative. We should also explore restorative justice models where appropriate, focusing on rectifying errors and preventing future ones, rather than immediately defaulting to costly and often devastating legal battles that drain resources from both providers and the government.
Jordan, you've made a strong case for a more supportive, less punitive approach, emphasizing education and assistance for providers. Nico, you've underscored the necessity of robust enforcement, particularly against large-scale, intentional fraud, citing the recovery of billions. Let's consider the other side for a moment. Nico, how would you address concerns that an overly aggressive federal stance, even if effective at recovering funds, might inadvertently stifle innovation in healthcare delivery or discourage providers from participating in federal programs due to the perceived risk of scrutiny? Jordan, conversely, how would you ensure that a more educational, less punitive approach doesn't create loopholes that sophisticated fraudsters could exploit, ultimately costing taxpayers more?
Ada, the concern about stifling innovation is often overstated. Genuine innovation in healthcare aims to improve patient outcomes and efficiency, not to exploit billing loopholes. The federal government's enforcement actions primarily target practices that are clearly fraudulent or abusive, not those pushing the boundaries of legitimate care. In fact, by removing fraudulent actors, we create a more level playing field for ethical providers and innovative solutions. Furthermore, federal programs often offer waivers and pilot programs designed to test new models of care, demonstrating a willingness to adapt. The key is transparency and clear communication from regulatory bodies about what constitutes acceptable practice. We cannot allow the fear of scrutiny to overshadow the imperative of protecting taxpayer dollars and ensuring the integrity of a system that serves millions. The vast majority of providers are ethical and have nothing to fear from targeted, evidence-based enforcement.
Nico, the risk of stifling innovation is very real, particularly in areas like telehealth or value-based care, where new models often don't fit neatly into existing billing codes. Providers are hesitant to innovate if it means navigating ambiguous regulations and risking severe penalties. Regarding your question, Ada, ensuring a more educational approach doesn't create loopholes requires a multi-pronged strategy. Firstly, robust data analytics would still be crucial for identifying outliers and suspicious patterns that warrant deeper investigation. Secondly, we need to empower state-level agencies and professional organizations to play a larger role in compliance assistance, leveraging their proximity to local providers. Thirdly, increasing transparency around enforcement actions and sharing best practices can help prevent exploitation. Finally, for truly egregious intentional fraud, the full force of the law must absolutely be applied. The goal is to differentiate between the accidental and the malicious, not to eliminate accountability.
We've covered a lot of ground today, from the fiscal imperative of combating healthcare fraud to the potential for regulatory burdens on providers. It's clear that finding the right balance is an ongoing challenge. Thank you, Nico and Jordan, for shedding light on the complexities of this issue from your distinct perspectives. Your insights have certainly given our listeners much to consider regarding how we protect taxpayer money while ensuring our healthcare system remains accessible and fair for all. This conversation underscores the critical need for thoughtful policy that addresses both the financial integrity of our healthcare programs and the operational realities faced by those on the front lines of care. You can find more information and resources at tpbridgepod.com. Join us next time for another engaging discussion. Until then, stay informed, stay engaged, and keep bridging those political divides.